Number 24, this is where you will list all the procedures that the physician has listed on the encounter form. You will complete one line at a time. You will go 24A all the way through 24J in the first line before you go to line 2. All right, 24A, date of service, to and from. If you're filing for an office visit, it's generally the same date of service. If you look in that paragraph, I have an example, 03-2508 to 03-2508. It's the same date of service. However, if you're filing for hospital visits and the patient was hospitalized from 3/20/08 to 3/25/08, you would use those dates of service. And we have an example later. 24B, place of service. You will use the number here, which will not always be the same. It will depend on the services for which you are coding. Now, the place of service. 11 is for a medical office. Turn to page 19. There's some 11 for office, 12 for patient's residence. They do house calls nowadays. The patient was in the hospital when your doctor went for the visit, and you would use 21. It's the place that the services were performed. 24C, leave it blank. 24D, procedure code. You will retrieve these from the encounter form one at a time. Most times you start with the office visit first. Still going straight across. 24E, diagnosis code. Used to justify this one procedure. You will retrieve those from block 21. You see the arrow, block 21. You will also list them as 1, 2, 3, 4. Now look on page 17, just refer back really quick. That's block 21, and because we have listed the diagnosis codes in 1, 2, 3, or 4, that's why we only put 1 or 2, 3, or 4. 24F, how much was the office charging for this procedure? And you'll know because it's your office. 24G, how many days was the procedure performed, or how many units were used? Each procedure code specifies per visit or per unit. The patient was in for that one office visit, days or units would be 1. The patient was in the hospital and that doctor saw that patient on the office visits from 3/20 to 3/25. It will be 3/20, 21, 22, 23, 24, and 25. Actually 6 days. So it will be 6 days. 24H, leave it blank. I, leave it blank. J, find the physician's NPI number in your computer system and select it, and it will put it in automatically. Once again, this is the section for the place of service codes. We run through those really quick. 11, medical office. 12, patient's residence. 21, inpatient hospital. Inpatient hospital means the patient has been admitted for 24 hours or more. Outpatient hospital, patient was hospitalized for 23 hours or less. 23, emergency room. 24, ambulatory surgical center. You've heard of ambulatory surgery centers where you're being for same-day surgery and out. If you're working for a birthing center, you would use 25. 26, military treatment center. It's like the VA hospital. 31, skilled nursing facility. 32, nursing home. It's all about the title when you're differentiating between those two. You will know where you're working, so you'll know which code to actually use. You'll be using the same code over and over again. 33, custodial care. 34, hospice. 41, ambulance. It's on land, okay, like on the roads. 42, if you take an ambulance by air or water. 50, federally qualified health center. You've heard of family health centers that are actually regulated by the federal government, that actually receive grants and funding from the federal government, and they have that designation. 51, inpatient psychiatric facility. Once again, inpatient means you've been admitted for 24 hours or more. 52, psychiatric facility, partial hospitalization. Sometimes they actually do you're hospitalized part of the day, or you're hospitalized for a couple of days, released to go home. You will know your facility once again. 53, community mental health center. 54, intermediate care facility for the mentally retarded. 55, residential substance abuse treatment center. 56, psychiatric residential treatment center. 61, comprehensive inpatient rehab. 62, comprehensive outpatient rehab. 65, end-stage renal disease treatment facility. That's for dialysis. 71, state or local health clinic, public health clinic. 72, rural health clinic. Once again, that's a federal designation. 81, independent lab. 99, other unlisted facility. Once again, like I said, you will actually know what facility you are actually working in. Now we're down to block 25. Tax ID number for the office or position that you're working for. Most times if you hit enter, it pops in automatically. 26, you're already in the patient's account, so just hit enter. 27, accept assignment. You hit enter because the computer already knows if you take that insurance or not. 28, total charge. Hit enter and the computer tallies it up for you. 29, amount paid. You obtain that from the encounter form. You put the amount in, hit enter, and the balance due will print out itself. 31, signature of physician. Your office has authorized you to submit the claim on the doctor's behalf, and it will print out signature on file. 32, service facility location information. Hit enter, the computer puts it in for you. 33, billing provider information and phone number. Once again, the computer will put it in for you. Page 21, that is a completed encounter form. Top of the page is the date of service, charge, payment, and patient's name. The number at the top, 34328, that is a number of the encounter form because encounter forms are numbered in sequence, and that's to assist you in locating and making sure all encounter forms are accounted for. Top part of this encounter form is the procedures. The doctor has checked 99201 for the office visit. The front desk put in the charge, $75. Second column, your analysis without micro is checked, 81002 for $25. CBC 85025 is $60. The next column, DPT 90701 is $20. And TB time test 86585, cost is $20. Tympanogram, that's a hearing test, 92567 and the charge is $0. The bottom of the encounter form. For the diagnoses, nothing in the first column. Second column, otitis media is checked, 382.9. The next column, well child, greater than 2 years of age, V70.5. Those are your diagnosis codes and your procedure codes.